Hello, my name's Liz and I'm a respiratory nurse. In this video we offer a practical guide to having a consultation about inhalers. When discussing inhaler treatment with patients, it's important to practice shared decision making and support self-management. Links to resources that explain these principles are provided in the document that accompanies this video.
Before proceeding, let's take time to familiarise ourselves with the terms concordance, compliance and adherence. These are often used interchangeably and sometimes cause confusion. Concordance refers to the practice of working in partnership with patients to agree a treatment plan. Compliance refers to the act of following the treatment plan. Adherence refers to sticking with the treatment. Studies have found poor adherence with inhaled therapy. The following may have a negative impact on compliance and adherence. Fear of adverse effects. Belief that the medication is not needed or will not work. Not knowing what the medication is for. Complexity of the device. Complexity of treatment regime. Agreeing a treatment plan with the patient may improve compliance and adherence.
When prescribing inhalers, clinicians should adhere to local prescribing preferences where possible. You should be able to get a copy of these from a prescribing advisor or respiratory specialist. These are ours, and like most I've seen, they provide a mix of devices that are easy for the patient to use and fit into their daily routine, as well as being both effective and cost effective. In practice, I keep copies in my inhaler bag and on my computer so that I have access to them at all times.
Use single disposable devices and equipment to check patients' inhaler technique at all times. You should not use one device for many patients.
In this video, we use an exhaler only because we happen to be filming a patient video for this today. The essence of the consultation is applicable to any inhaler.
Each patient consultation should include discussing treatment options. Have a conversation with the patient to find out what their aims and hopes for treatment are, and what concerns or fears that they might have. How to store the inhaler. How to use the inhaler. Cleaning the inhaler. What to do if they forget to take a dose or double dose. Replacing the inhaler and going to the hospital or clinic.
Hi Jill, what information have you been given about today's appointment?
Well, I know I've got COPD and I'm here to find out more treatment I can get for it. I've got these 2 inhalers and they do help, but I'm still struggling a bit.
Okay, in what way are you struggling?
I'm struggling with my breathlessness. I know it won't go away completely, but I want to get it better. I keep getting chest infections and it's just getting me down.
Okay, so sounds like reducing the breathlessness and the amount of flare-ups is important to you.
Yes.
Okay, before we go on, would it be okay if I could just check that you're using your inhalers correctly?
Yeah.
That's good, you're using them correctly. So tell me about your daily routine, including when you take your pills and inhalers.
Well, I get up about 8 and then I get my breakfast and I take my pills and my inhaler after that. And then I go about my day and then at night time I take my pills and my inhaler before I go to bed.
Okay. Do you always remember to take your pills and inhalers?
I always remember to take my pills, but I do sometimes forget my inhaler.
Okay. When you say you sometimes forget, how often, say in 1 week, would you forget to take your inhalers?
Not often, just sometimes, once in a blue moon, once a month or something.
So Jill, where do you keep your pills?
I keep them in the cupboard in the living room.
Okay, and what about your inhalers?
I keep them in the kitchen. I suppose I should keep them together, shouldn't I?
Would it help you to remember to take them?
Yes, that's what I'll do. I'll store them all together.
Right. The living room would be a good place to store them because they should be kept in a dry environment away from heat and children. Tell me, would children be able to get into the cupboard in the living room?
No, it's high up and we keep it locked.
So we know that you're using your inhalers correctly and are using them when you should.
Okay.
So we can now look at inhalers that will help to reduce the breathlessness and the amount of flare-ups that you're having. These are the ones that the chest specialists recommend. Okay.
Okay. And which one's the best one?
There's no evidence that one's better than the other. However, you are using powder inhalers and you're managing them well, so I think we should maybe stick with them.
Okay.
So we should maybe just take this one out of the equation because it works a wee bit differently. So then you're left with these two, okay? They're both used in similar ways and they're both there to help reduce the frequency and severity of flare-ups, okay? This one, you would just take 1 puff in the morning, and this one you would take 2 puffs morning and night, and it really just depends what you would prefer to do.
Okay. I think it'd be easier if I use it the same as these ones, where I take it twice a day.
Okay, so that's
That'd be
that
simpler.
one. So I'll tell you a wee bit about this inhaler,
Okay.
and then I'll show you how to use it. Okay. So this inhaler's got 2 drugs in it, and they'll help to reduce the breathlessness and the amount of flare-ups that you're having. Okay. And it's really important that you take it morning and night, whether you need it or not, because they can take up to 6 weeks to work. So it should be taken whether you've got infection or not every day. So it'll go on your repeat prescription. Okay, so you just need to make sure and renew it at the end of every month.
Okay.
But we'll talk a bit more about that later.
It won't interfere with my other medicines or my medical conditions, will it?
It shouldn't do, but if you do experience any side effects, then just give us a call. Okay. The main side effects of this, it can cause voice hoarseness and a bit of thrush in your mouth. So after you've used it, rinse out your mouth and brush your teeth.
Okay. So how do I use this inhaler?
Okay, I'll show you how to use the inhaler. When you get the inhaler, there'll be instructions inside the box, so take them out and it will show you how to use it. Okay, you should take your inhalers at the same time every day. Okay, you can take them with or without food, and when you're taking it, keep your head in a neutral position.
Okay.
Okay, so this is the inhaler. If you open that up, that's the dust cap. Okay, and when you open it up, you'll hear it click. This is a mouthpiece, so you just have to make sure that when you're not using the inhaler that the dust cap's covering the mouthpiece, because you don't want any dirt or dust to get in there. Okay. These are the wee air vents, so make sure you don't cover them with your fingers or your clothes. At the front there's a wee dose counter that counts at 120 downwards, so you know when you're getting empty. And at the back here there's a wee label, and on that label you would just put 6 months from when you opened it, because that's when the drug would expire. But you'll be getting a new one every month, so it shouldn't expire. Okay. So to use it, you open that up, again you'll hear a click. You breathe out but not into the device, so like this. You put it in your mouth, seal with your lips, breathe it in hard and fast and hold your breath from 5 to 10 seconds, so like this. Show you from beginning. And then breathe out.
Okay.
So you'll have to take another puff, so you just close it over and do the same again. And this time if you just listen out, when I breathe it in, you'll hear it click. Okay, and that's when you know you're using it properly. So open up, click. Okay, and then when you're finished, just give it a wipe with this dry tissue. Okay. And close it over, and that's you. And then just have a wee look at your dose counter to make sure that you're not running out.
Okay.
Okay. So Jill, I'll let you have a wee practice, but once it's opened, I'll put this wee disposable mouthpiece cover on it for you. Okay.
Right, so I had to open it till it clicks.
That's right. Okay. Just pop that on. That's you.
And then I had to breathe out and then breathe in. that right?
Okay, that's fine. And then you would just repeat that.
Okay.
Again, you take a second puff. Okay. And then again, just remember to clean it. Okay. And after you've used it, remember to check the dose counter.
Okay.
Okay. And it'll count from 120 downwards, so you know when it's getting empty. When you get to about 10 doses, put in a repeat prescription. Okay. And after you've used it, rinse your mouth out and brush your teeth, as I say, just to prevent the voice hoarseness and thrush.
Okay. What if I forget to take it?
If you forget to take it if you remember within an hour or two.
Okay.
Anything more than that, just forget it and just get back on track with the next dose.
Okay. And what happens if I take too much?
If you take too much, just give us a wee phone and we'll advise you.
Okay. And what do I do if I forget how to use this once I'm back home?
Right. If you forget to use it, then there's a few things you can do. There's the picture instructions inside with the inhaler leaflet.
Okay.
You can also ask the pharmacist and they'll show you how to use it.
Okay.
And there's this website, My Lungs, My Life.
Oh.
Right? It's got videos on it and it shows you how to use them, so you can review it from the comfort of your own home.
Okay.
Okay.
Thank you.
So when you're going to the hospital or clinic, take your inhalers with you along with a list of medications that you're on. Okay. Really important you take your inhalers with you because they might not have the inhalers that you're on. So that's us. Any questions, Jill?
No, that's been really helpful. Thank you.
Right. If you have any questions, then just give us a phone.
Okay.
Okay.